Welcome to Sheriff's Talk, brought to you by the Missouri Sheriff's Association. During this episode and ones that follow, we'll be talking with sheriffs from across the state regarding topics relating to county law enforcement and jails. So please stay tuned. We'll be right back after a word from our sponsor.
The Missouri Sheriff's Association, or MSA, was established in 1945 with the goal to support the sheriffs of Missouri and their staff by offering law enforcement training, legislative support, and technical support. MSA offers memberships, agency contracts, and vendor partnerships, and each comes with their own variety of perks like full access to the learning management system and support, tax-deductible contributions, membership card, vehicle decals, sheriff and jail magazine subscriptions, advertisement opportunities, reduced training prices, access to webinars, podcasts, and training, and CCW support. Join the Missouri Sheriff's Association and proudly display your support for your local law enforcement and Missouri sheriffs. Your tax-deductible contributions will go a long way to ensure the Office of Sheriff in Missouri remains strong, independent office, answerable to those citizens that it is sworn to serve and protect. Your support is what makes the Missouri Sheriff's Association great, so visit mosheriffs.com and become a member today.
Okay, welcome to Sheriff's Talk. I'm your host, Sam Boyd, and I'm here with Sheriff Jason Klaus from Perry County. How you doing, Sheriff?
Doing all right today. How about yourself?
Good to have you here. Good, doing good.
Thank you.
So to get started, let's talk about Perry County. Give me some of the demographics of Perry County.
Yeah, Perry County is in the southeast Missouri part of the state. We're just sandwiched in between St. John and Cape Girardeau. To give you some perspective, we're a perfect triangle. So, in Perryville is our centerpiece of our community. We have about 20,000 population. So it's just a really good third-class size county, and we do have a lot of great resources.
All right. How long you been sheriff?
I've been sheriff for about a year and a half.
Okay.
I was appointed Sheriff Gary Schaaf, retired in the middle of his term, and I was appointed by the commissioners.
And you're running again?
That's correct.
Okay. So how many officers or staff do you have in the Perry County Sheriff's Office?
Yeah, I have a total of about 35 personnel, and that includes office staff, patrol deputies, dispatch and communication officers, and jail staff.
Okay. Are you short?
We are to capacity. We have full staffing at this time.
Okay. Did I ask you how many inmates or how many you can house?
Yeah, so our current capacity is at 40. We are in the process of building a new justice center in Perry County. We're really excited about that project, and that will take my bed capacity from 40 to 80.
Okay. So kind of why you're here today is to talk about mental health resources. Over 10 years ago is when I became the jail administrator. And mental health, CIT, those kind of resources were maybe just getting started around the nation. But in Missouri, jails, sheriff's offices, communities really have had to adapt to the mental health crisis.
Correct.
Me, myself, or Sheriff Dickerson and her jail administrator were here a couple weeks ago talking about how that's affecting jail populations and funds and all that stuff. So what are some of the resources these sheriff's offices can do and reach out to get help with mental health issues?
Yeah, there's actually a lot of things going on in the state of Missouri right now to assist law enforcement with our mental health. Those individuals that are suffering from either a mental health, substance use disorder, what we'll call a behavioral health disorder. And specifically, those are really highlighted in our jails. At that time, a lot of individuals that come into our jails are coming to us with substances that they've been using for a long time. And then once they're incarcerated, they will detox. And really, those mental health issues really become an issue. And that's a real struggle for all the sheriffs, all the jail administrators throughout the state. In 2013, Governor Nixon at the time put the initiative together through the Department of Mental Health and the Community Behavioral Health Centers called the Community Behavioral Health Liaison. There's currently 81 of them throughout the state, and they also assist jail staff with those inmates that we have that are identified as suffering from a behavioral health disorder. A couple things that you can do is implement a jail screening tool to help the jail staff identify specifically which inmates may be suffering from those disorders. And also, I highly promote CIT training, getting those officers crisis intervention team trained, whether it's the 40-hour class or the 20-hour class that specifically for jail staff.
So you mentioned a screening. Is there somewhere that jails can go to, instead of creating one themselves, is there somewhere they can go and grab a screening that they can incorporate that into their booking process?
Correct. There's a evidence-based screening tool from the policy research analysis. It's again evidence-based, and I think it's an 8-question screen that you can implement right in with your or your jail booking system, your JMS system, and if you use it accurately, it will actually tell you which ones to make the referral to. So if you're screening them and they score high, you can make a direct referral to your community behavioral health liaison. They may be able to come directly to your jail or do a screening over line or online and help you with that.
Okay, these liaisons you're talking about, let's say a rural county that's rural Missouri, it's not near a real populated area. Do these liaisons exist in all across the state, or do they have to reach out to a larger population to reach one of these people?
Every county in the state has access to one, if not more, community behavioral health liaisons. When the program was implemented in 2013, there was 31 of them. And a lot of those CBHLs covered maybe 5 or 6 counties. So it really was a delay in that response. Just a few years ago, Governor Parsons implemented 50 more. So there's 81 of them available. So most every county will have general access to one relatively quickly.
Okay. What about resources like, the big one for jails is medication, getting medication to medicate these folks, or, in certain circumstances, the inmate still can take the medication if they want to or not. But as far as the resources to get the medication, where the jail isn't paying for so much for it, is there something like that exists?
Yeah, so we partner at Perry County. We partner with Gibson Center for Behavioral Change. It's a substance use provider. They actually have a 40-foot converted RV that they take to rural communities in their catchment area. They actually bring it to my sheriff's office. We then escort inmates that volunteer for that program. They are appropriately screened and assessed by the Gibson's personnel, and then they will receive that medication-assisted treatment and or counseling, whatever is needed, while on that bus. And that's free of charge. It's free of charge to my inmate and to the sheriff's office, just from the different programs that Gibson has access to.
What about when the inmate leaves jail, either by bonding out or his sentence is over, if they get sentenced to a year or more, or charges dismissed, whatever they may get out of jail for, back into the community? Is there information that jails can give them, and where would they get that information from?
Yeah, so if you are working and collaborating with one of your providers in your community, work with them on that. As Sheriff Dickerson probably talked about her jail navigator, one of the main goals of that navigator is that re-entry piece, making sure when that inmate releases back to the community that we'll call it a warm handoff, that person who's now released follows up with that community provider, whether that's a mental health treatment, substance use treatment, or both. And it's really important to have that connection piece.
Okay. I don't know if I'm going to say this right. Can they tie that to like a probation or parole or something? Because it's all on the person getting out.
It is.
Whether they actually follow up and keep up with the treatment and want to get help. So if they're getting on probation or parole and or a condition of bond, can you do that kind of thing?
It's really all about communication. It's about establishing those collaborative relationships with, whether it's a probation parole officer, maybe they're going into drug court, maybe they're discharging from jail into drug court. Really, it's the continuity of care. We want to make sure that whatever services that we start while they're incarcerated definitely continue once they get out. It's really to focus on that recidivism rate. And Sheriff Kaiser was on the podcast several months ago and did a tremendous job describing his program that he has in his jail. And I think something like that, gives all sheriffs hope that, hey, we can actually do more in our communities. Again, establishing those relationships, thinking outside the box, because really it's about keeping our communities safe.
Okay. So let's backtrack a little bit. And how did we get to this state with mental health?
Yeah, that's a great question. Several years ago, and talking around, and I was in law enforcement. I've been in law enforcement since 1996, and I don't always remember the numbers being the way they are right now. In fact, when I went through the academy, I never thought that I would be working so much with the mental health services as I am now, whether I was a patrol officer, detective, or now a sheriff. So I don't have that answer. I know there were different services back then. We talk about state hospitals, things like that. Those did phase out, and I believe appropriately so. There is a need there, but I think the community model works best. I don't want to just house those that are mentally ill, because it is an illness and we have to treat it as such. But just holding individuals in jails and or in hospitals probably wasn't the best thing to do. So now we have to work within our community resources to try to work our way out of this and really what's best for that individual.
Okay. Generally, do you see drug use as a major problem in causing the mental health issue?
Yeah, I think it's way before that. I think you have to look at the trauma that probably most individuals experience at some point in time in their life, whether that's as a child, maybe they were physically or sexually abused at the hands of a parent or a loved one, maybe something else, they were victimized to at some point in time and never received the right kind of help at the right time. So they started using substances to mask some of those signs and symptoms that they were dealing with, which then ultimately led to them being justice involved and in our jails.
So self-medicating?
Yeah, absolutely. Most of it is. And if you can just start digging deeper, and I really enjoy talking to those individuals that are incarcerated and to hear their stories. And Sheriff Kaiser talked about this too. He talked about it at their graduation. When you hear some of their stories, for the officer, for my staff, for me, it helps you develop empathy. It helps see that person, that there are circumstances in their life that maybe they couldn't control, but where they're at now is the result of that. And I think we as public servants have an opportunity to serve that individual in any capacity, even while they're incarcerated, to try to get them on the best path.
Okay. So what is CIT?
CIT is Crisis Intervention Team. It was actually developed in Memphis, Tennessee in 1988. Came out of a officer-involved shooting and deadly force, and it was because that individual was showing signs of a mental illness, and those officers just were not trained to recognize those signs and symptoms. So even 30 plus years ago, these things were occurring. They developed a 40-hour curriculum, now known as CIT, to help train officers in recognizing signs and symptoms, de-escalating that issue, and then hopefully referring them on to community resources as opposed to jails and emergency rooms.
What different levels of CIT do you have? I've heard there's maybe a jail version.
Correct.
Yep.
So we really want to try to cater the training to that individual officer, the need of that community. The standard training is a 40-hour class. I mean, it's all post-certified and free. We recognize that if we could not divert to community resources and they were going to be justice involved, just because they're incarcerated does not mean that illness goes away. So jail officers need to recognize those same signs and symptoms. And so we developed a 20-hour class, recognizing that most sheriffs have limited training budgets. They got to focus on their post-commissioned officers first, but jails are a huge liability, and we have to train our jail staff as much as, if not more than, our patrol staff.
Okay. So let's go back to the liaison. Let's list some of the things this liaison can help a jail or a sheriff's office with in the mental health process of getting an individual through that process.
Yeah, it's really about early diversion. It's about that initial contact. So if you identify that your patrol officers are going out to a house or a particular address, dealing with the same individual multiple times, no crime involved, but really ramping up some of those services, that's the right time to maybe make a referral to a community behavioral health liaison. And hopefully you might even take them with you. Maybe next time you get a call, or maybe you do a follow-up with that CBHL with you. And we'll call that a co-responder, where they're going actually out with you. Or you just make a written referral to that CBHL, and then they can either contact them by phone or even go out in person to try to engage that person in services. The goal is to try to engage them early. That way they don't, continue on with those calls for service and ultimately get, where there is a victim or a crime involved.
Okay. So we've talked about help for jails and inmates and dealing with people in the public, but what about for officers?
Yeah, so I really think that's key. And we've really missed that historically speaking in the law enforcement profession, and that's looking at ourselves. We go through different examinations upon hiring, psychological exams, fitness exams, but that's really the last time that most law enforcement officers get tested on any of those things. So we want a healthy officer to start, but when you think about the career's worth of traumas that we put our law enforcement officers through just by doing their job, that takes a toll. So we want to make sure that we take care of them along the way. Most jails, most sheriffs, most police officers are struggling with staffing. And a lot of it has to do with burnout, compassion fatigue, we'll call it too. And we need to build that in all the way through a career of a law enforcement officer. So focusing on that individual, making sure that they are mentally healthy, physically healthy, to make sure that they're doing the best job that they can for our citizens.
Are there different resources that an officer needs to reach out to other than what we've talked about today for the jails?
Yeah, CBHL can be that referral. That is not their main primary, but listen, a relationship's a relationship. We have something in the state of Missouri through CIT called the First Responder Provider Network, what we call the FRPN. We've been developing this for several years, where we ask for applications, we vet them out, and then we do an interview process. And we want to identify behavioral health professionals that really understand our profession, understand law enforcement, first responders, veterans. That way they are dedicated to help with that specific trauma. So we have that First Responder Provider Network. We also partner with the Missouri State Highway Patrol and their defense team and help with, or what they call a post-critical incident seminar, PCIS, which is available about 3 times a year, free of charge to the first responder and their spouse, that they can go to a retreat format, meals included, and we do, different seminars, small group sessions, things like that. That's really beneficial.
With officers, there's that stigma of saying you have a problem or you're experiencing difficulty mentally. How do we get rid of that stigma? And then when they do tell somebody, is it going to be confidential, and am I going to be labeled, and am I going to be able to take a medication maybe that I've been issued? What do you see some of the issues there?
Yeah, well, I think that's where leaders lead, and you lead by example. And as a sheriff, that's all I can do for my staff. So when I recognize that maybe they are struggling with something, it's my job to reach out to them, or it's my job to find somebody to check in on them. And because I want the healthiest staff that I can. We've seen for years that law enforcement suicides outnumber line of duty deaths. And that's on us. That is on us not recognizing some of those early signs and symptoms. So early intervention, really just knowing your staff, checking on them on a regular basis, providing as many resources that you can in-house, and just making referrals. Missouri CIT also allows all Missouri law enforcement officers to download free of charge the Cortico Wellness app. And it is a 24/7, 365 available app on your phone that goes through a bunch of self-assessments, be able to reach out for different help. Really just kind of, if you're in a car and you're kind of feeling different things, you can get on that app and try to figure out what you're dealing with, and it will give you some things to help you through that process. And it's really been a huge benefit. We've had it available for about 2.5 years. And you can find that QR code and download that, again, free for every Missouri law enforcement officer and their spouse.
So, I've read some of the statistics where, the normal everyday citizen will go through 1, maybe 3 traumatic events in their life, where a police officer, deputy, jailer will go through hundreds.
Correct.
Based on what they see during their job. So, it's something we need to get a hold on.
Yeah, and speak with many officers, sometimes it's not always about the critical event that they struggle with. It's about that internal pressure that we talked about, that stigma of like being okay, like, man, I was really affected by that accident, or that officer involved shooting, I that's really, I can't sleep, and all of those different things. And if we just like, hey, as the old saying goes, just suck that up, that's what you signed up for, I'm not okay with that. It's different today than it used to be.
Right.
And I think leaders, as sheriffs of the state and as police chiefs, anybody in a leadership role, we need to look at this and really take a focus on it, because staff, we have to take care of those individuals that put their lives on the line to come serve our communities. It's on us to make sure that we take care of them so they can take care of our communities.
All right. Well, is there anything else you'd like to talk about, Sheriff?
I just appreciate the opportunity, and just look forward to, if anybody wants to reach out for any follow-up questions, feel free to reach out to me. I'll be happy to help them through.
All right. Well, thank you very much for coming in. I appreciate it.
My pleasure. Thank you.
Thank you.
Yep.
All right. Thanks for watching the show. Please tune in next time. I would also like to throw a plug out there for the Missouri Sheriff Association and their membership. So your membership with the Missouri Sheriff Association allows officers throughout the state funds to be trained on a lot of this stuff we talk about during this podcast. So if you could just go to Missouri Sheriff's or mosheriffs.com, check out the membership page, see the stuff that you would get. It's a small fee to become a member, and we would love your support. And thank you for watching the show.
This is the host of Sheriff's Talk, Sam Boyd. We hope you enjoyed the show. If you would like to find out more about MSA or become a member, go to mosheriffs.com and click Become a Member. Hope to hear from you soon.